I'm Marwa Shazli. I'm QFIS Vice President. I'm glad we will be moderating today's session or today's event with all of you. We believe that this event is going to be one of a kind because today we chose to not focus only on raising awareness for health-related issues as we usually do, but we chose to spot the light on inspiration and hope that are the keys to pass difficult and challenging times. So I will start by mentioning the agenda for today. First of all, we're going to have welcoming remarks by Dr. Maggie Haj, the Associate Dean for Academic Affairs at College of Pharmacy. Then we will have welcoming remarks by Ms. Hindi Naimi, QFIS President. And then we're going to have the film introduction by our guest speaker, Ms. Tara Shadid. She is the film director of the film we're going to screen today. Then we're going to the film screening and having a remarkable open discussion with our guest speaker, Ms. Sandy Thompson, the breast cancer survivor. And then we're having the online questions game and moving last for the group picture. If you saw our social media platforms, we mentioned that we are inviting all of you to wear pink or a pink ribbon for the group picture at the end. So this is a gentle or friendly reminder for all of you to join us to document this moment. So we'll start by the welcoming remarks by Dr. Maggie Haj, the Associate Dean for Academic Affairs at College of Pharmacy. You have the mic, Dr. Maggie.
Thank you so much, Marwa. Good afternoon, everyone. I'm very pleased to welcome you today to our breast cancer awareness event. And I would like to welcome our special guests, Mrs. Sandy Thompson and Ms. Tara Shadid, for coming today. Thank you so much for being with us today.
My pleasure.
Thank you. Let me speak first about breast cancer. According to the World Health Organization, breast cancer is the most common cancer in women in the world. And if we look at the data, especially from low and middle income countries, we will see that the incidence of breast cancer has been really increasing over the last years. And as you may know, there are no enough information about what causes basically breast cancer. However, what we really know and we are really sure about is that early detection of breast cancer is really the basic step for controlling this disease. When we detect breast cancer early and when enough and appropriate diagnosis and treatment is given, there's really a very good chance that breast cancer patients could be cured. However, if this disease is detected late, unfortunately, the option to cure patients with breast cancer is not anymore an option. And what's available is basically palliative care for patients who have breast cancer just to reduce their pain and their suffering. Hence, it's very important to increase the public awareness about breast cancer and about the early screening for breast cancer. And here basically comes the basic role of pharmacists and future pharmacists, our dear pharmacy students today, in improving public awareness about breast cancer. Pharmacists are often the first point of contact with the community, and they are really in an excellent position to educate the public about breast cancer. So in addition to their role in basically treating cancer patients, the pharmacists can really offer important information to the public about breast cancer risk factors, about the importance for breast self-exam and a clinical breast exam, doing the screening, basically imaging, whether mammography, ultrasound, or other methods, especially in those who are at high risk and starting basic certain ages as per the recommendations of different guidelines. Therefore, I'm very happy to see this event happening, and I'm very happy to see our guests today joining us and sharing inspiring stories about their basically their experience with breast cancer. And I would like to take this opportunity to acknowledge the efforts of organizing this event, basically the efforts of our pharmacy students in organizing this important outreach event, which is happening despite all the unusual and uncertain circumstances that are imposed by the COVID-19 pandemic. So thank you so much again for joining us in today's event, and welcome again. I wish you all the best in this event today. Thank you so much.
Thank you so much, Dr. Maggie, for your nice words and support. And now we're going to have the welcoming remarks by Ms. Hind Al-Naimi. So, Ms. Hind, you have the mic.
Hello everyone, I'd like to welcome you all and thank you for joining us here today. We're very delighted to have Ms. Sandy and Ms. Sarah joining us and adding up to our virtual event. So as Dr. Maggie said, as future pharmacists, one of our roles is to educate and raise awareness. And although COVID-19 stopped most of our campaigns and outreach activities that we used to do in our association, but it's also a powerful reminder that we are all in this together, especially in October, and choice, actions, and awareness have a really powerful role to protect. So the Move Forward campaign started on cue for social media to raise awareness about breast cancer. And one of the big events that we are doing this year is today's event, which I truly believe is a big tool to spread hope and be force for good. So thank you all for joining us, and back to you, Marwa.
Thank you so much, Ms. Hind, for your nice words and for your continuous support. Now I don't know, there is a problem with presenting the slides, but now we're going to have the film introduction by Ms. Sarah Shadid. Ms. Sarah Shadid is a career graduate since fall 2019 with a distinction award in Bachelor of Arts in Mass Communication, Broadcast Journalism Department, and a minor in English Literature. She's interested in filmmaking and social media platforms as a content creator. She's also a media researcher in the Ministry of Culture and Sports here in Qatar, and she has her own personal project, which is Sarah Records. It includes photography, videography, and documentation for different stuff in life. She was also in charge of the registration team of TEDx and one of the organizers of the event. Thank you so much. Thank you so much, Ms. Sarah, for specifying this time for us. Actually, Ms. Sarah wasn't able to be with us here today, but she was able to film a short video that I will be screening in a minute. And here's also her Instagram page for documentation of this. I will share it in.
مرحبا جميعا، أنا سارة. أنا بؤمن تماما إنه القصص والتجارب اللي بنسمعها بحياتنا هي قصص يمكن ما تكون وصلت لغيرنا. ونحن بدورنا إنه إحنا نوصل هالقصص وهالتجارب لغيرنا اللي ممكن تكون بالنسبة لهم مصدر إلهام، مصدر لمعرفة كثير أشياء ما كانوا يعرفوها للشيء اللي هم عم يواجهوه بحياتهم. كثير مرات إحنا بنكون بندور على قصص مشابهة لقصصنا لحتى نقدر نحس إنه في أمل نتخطى الألم، نتخطى المشاكل اللي ممكن نعيشها بحياتنا. قصة ساندي واحدة من القصص اللي فعلا أثرت فيني واللي فعلا حسيت بأهمية نشرها، بأهمية إنه في كثير ناس عانوا مع سرطان الثدي وكان محتاجين قصة مثل قصة ساندي اللي هي تعدت المرض وكانت واعية جدا بأهمية الفحص المبكر، واعية جدا بأهمية إن هي تخلي المرض ما يتحداها وما يكون المرض هو مسيطر عليها، بل هي تسيطر عليه وهي تتحدى. فألهمتني جدا بقوة إصرارها وبقوة تحديها للمرض، ووجدت في قصتها سعادة كثير ناس وإلهام كثير ناس. فقصة ساندي كانت بالنسبة لي هي الفيلم الأول اللي بقدر إني أنا أوصل فيه للناس رسالة ملهمة يستلهموا من خلالها قصة ساندي وكيف إنها قدرت تعيش حياتها بشكل طبيعي. بعد ما أثرت فيني ساندي وعملت القصة وتصورنا أنا وفريقي، كان بالنسبة لي أصعب مرحلة هي مرحلة المونتاج واختيار المقاطع اللي تنحط في الفيلم وإنها هي تتحدث عن قصتها بشكل مختصر، لأنه قصة ساندي خلال الساعتين اللي صورناها كانت مليئة بالتجارب، مليئة بالمواقف اللي واجهتها خلال فترة المرض وخلال فترة ما بعد المرض، فكان صعب جدا، أو نحكي تحدي، كان فيها تحدي إنه أنا أختصر الفيلم ويكون في أقل من 20 دقيقة. أنا بتمنى اليوم إنه فعلا الفيلم جسد قصة ساندي بكل شفافية، بكل اختصار عن قصة ساندي، وصلت رسالتها الأساسية وهي أهمية الفحص المبكر لسرطان الثدي لحتى يكون هو الحل في إنه يكون الكشف مبكر جدا ونقدر نتعافى منه بفضل الله. ربما كان هذا الفيلم فيلمي الأول، لكن شعرت بمسؤولية من بعدها كبيرة جدا بعد ما شفت ردود أفعال الناس عليه وكيف إنهم تأثروا بقصة ساندي. شعرت مسؤولية إنه كثير ضايل القصص لازم نوثقها وننشرها بين الناس. أنا سعيدة جدا إنكم حضرتوا الفيلم، وهذا الفيلم رح يكون مصدر إلهام لغيركم، فانشروه بينكم لحتى تعم التوعية بأهمية الفحص المبكر. شكرا جميعا.
It really excited me to show the film, which we're going to screen in a bit. And now it's time for the video, so I will be sharing it in a second.
Along the journey, there's different things. My marriage had broken up. I wanted to get on with my life, and this interrupted me. And to be quite honest, it started to make me a little angry. I wanted to just get on with my life, and my body was stopping me. And so if I'm, thinking about the body-mind connection, I'm like, okay, why am I not supposed to leave yet? Why is my body stopping me from going where I want to go? I didn't want to talk to people about it. I didn't want anybody to know. I just wanted to get on with my life. What I wanted was action, and I was not going to let this slow me down. And so I just wanted more action. I didn't want to sit and meditate and think about it. It was done. It was over. I wanted to move forward.
Sometimes things get dark, and it's just difficult. I think that the only way to get out of it is to move forward. Give yourself a little bit of time to be sad or mourn or do whatever you need to do. You need to find the light again. You need to do 24 hours a day, one step at a time, and that's it. That's what you can do. And it works. It's a very effective tool. You just have to find the light and keep on moving towards it.
There you go. For me, happiness is not complicated. You have to accept who you are, you have to accept whatever your situation is, and you have to surround yourself with love. So I have cats, I have a good set of friends, I do the things that I need to do.
Hello.
Hey, how are you?
I'm fine. How are you?
I'm well. So tonight, how's the cake coming?
Yeah. It's cupcakes. Yes, definitely cupcakes.
So is it the two different colors we talked about?
Yes, they are.
Okay, well get going then. You've only got a few hours left.
Yeah, that's what we're planning for.
Okay, bye.
Bye.
Perfect. The Dragon Boat team is definitely a huge part of my family here. They supported me through the entire journey, and I'm extremely lucky.
I am extremely blessed, and I've always figured that I'm very blessed. When you leave one place, you often think, I will never find these relationships again. I will never find this tight bond again in my life. And every time I move, I find it again. We're a family, and it's a family of people who love and support each other. And we've been going strong ever since, so it's been 5 years. We celebrate 5 years on November 14th.
Are you ready? Wow. This is a lot of calories.
اتفزت مبروك
يميني
مش عارف بقى قول له لحد ما اشوف لا مبروك ايوه بس عمل بقى خلاص
Who is Sandy?
I don't really have an answer for that. It changes every day.
Who's Sandy before cancer?
Sandy is the same person before and after cancer, really. I think the difference is that before cancer, I would plan things well in advance. And once I was diagnosed with cancer, I was a little more aware of my mortality and a little more aware that anything can happen to change your plans. So I stopped making plans that were far in advance, and I started to live my life much more one day at a time. And I think I started to enjoy every moment as opposed to waiting for a moment that I would enjoy, if that makes sense. It was just one more thing I had to contend with. So I felt like, you know, typically when you have a big thing that happens in your life, they say it's 12 to 14 months of grieving time, you know, and to go through all the stages of, you know, sorrow, and then, you know, there's just 5 or 6 stages that you go through. And I felt like my time to grieve at the end of a relationship was interrupted by cancer. And I don't know if that makes any sense to you, but, you know, I wanted the full amount of time to get over this big event in my life. And instead what happened was I was diagnosed with cancer. And now the focus is not trying to process the end of a relationship. Now the focus is dealing with a cancer diagnosis. And then there was the heart event that happened, you know, 10 months after that. It's like every 10 months something big was happening. And, you know, there were days when I was just emotionally tired. I was done. I just thought, okay, I don't know what else to do. All I can do is just move to the next step. I can't do anything else except put one foot in front of the other. And those days were hard. I went every year at 44. Normally in Canada we go at 50. And I was a very different shape then than I am now. And I had always thought that if I had breast cancer, I would never know it. I would never have any idea. I was not a small woman. And I thought, I'll never know. So I went for mammograms. And at the time I was 48, it was my 5th mammogram. And the look on the woman's face when she did the mammogram sent me to a bookstore because she looked sad. There was just this look on her face. And I think that, you know, everybody goes, oh, that, you know, that you couldn't have known that. So, well, of course I knew that. Everybody has a human reaction. And as soon as she saw the screen, she just had this look that she knew something was there. But I mean, as a technician, she's in Canada, as a technician, you're not allowed to say anything. So, but I knew from the look on her face that there was something that she saw. So after the biopsy, the woman who had come out, maybe it was actually it might not have been the biopsy, it might have been the second mammogram. Anyway, I don't remember. But the woman came out and basically said, see you next year, see you next year, see you next year, then looked at me and said, enjoy the rest of your day. And I'm sure she didn't mean anything by it, and I'm sure many people wouldn't have picked up on it, but I was so attuned to there's something wrong that the fact that she didn't tell me that she'd see me in a year told me that I was in trouble. As long as you approach cancer with a logical, pragmatic thing, just as you would if you're studying for an exam, you know, it's overwhelming. But if you look at it logically and say, okay, what do I need to do now? I need to get an appointment. How do I get that appointment? I need to call my doctor. How do I get into my doctor? I'm going to call her right now. Okay, that's number one. You've done something. Because I think that if we're prepared the fear goes away, or it gets tampened down. It's not raging. It slows down. As soon as we know, okay, wait a second, somebody else has gone through this journey, and oh, look, she's sitting in front of me. And oh, look, she's not depressed, and she still has her energy, and oh my goodness, look, she's normal. I think that once we see that, it's not as scary. So as soon as my friend told me, I was like, okay, you're okay. I'll be okay. Because it's fear. And fear is always of the unknown. So if you know things, it's why I did so much research. If you know things, it's less frightening because you have information. Right? Many people have walked this road before you. You're not the first person on this road, on this journey. When I woke up from the heart attack, I was in a room, as you are, and there was a young, an intern in my room. And the first thing he said to me was that I couldn't be on this medication anymore. And I remember being very upset because it was the only medication I could be on as a woman who was not menopausal and not postmenopausal. And I said, well, but then how am I going to be protected against breast cancer? He said, well, your cancer's in remission. And as soon as he said the word remission, I wanted to jump right out of the bed and scream at him, because I thought, if you say remission, you are assuming cancer is going to come back. You're saying that cancer is just laying dormant in your body when you say remission. And so I said, I just had a heart attack, and I'm laying in the bed, and I said, don't ever say that to a patient again. I said, don't ever say that to somebody. And he said, well, what do you mean? I said, you just said to me that my cancer is probably going to come back. And he said, no, I didn't say that. I said remission. I said, remission means that cancer is dormant and the likelihood of it returning is pretty high at some point. I said, so don't ever say that to someone. And if I can't take the medication, I can't take the medication, whatever. But at that point, he told me that the medication had actually caused the heart attack. So tamoxifen in some people can cause a blood clot. And that's what happened with me. And probably as a result of that, because I was still, now I'm 49, but I still have estrogen in my body. And 4 years later, I had a recurrence. And it came back in the exact same spot with the exact same woman giving me that look that said, uh-oh, 0.4 millimeters, tiny, like barely a dot. It seemed overkill to me to have to remove an entire body part for this teeny tiny little thing. But that's what they do, that's the protocol. How did you decide to do a mastectomy? I didn't have a choice. Because I had had radiation, the only other option is to have a mastectomy. My choice was to have both done. I didn't want to ever hear you've got cancer again. I didn't want to be lopsided, which is, a factor, because I was very large-breasted at the time, and it would have been problematic for my back. And I also thought, no, I want to feel good about this. If I'm going to have a breast removed, then I want to be symmetrical. I want to be okay when I look in a mirror, because a lot of women who have mastectomies, it really affects their self-esteem. And I thought, no. I don't want to deal with that. It's going to be hard enough having a mastectomy, but so get rid of them. I don't ever want to be in this position again. When you've gone from whatever shape you are, where it's been part of your identity, suddenly your identity, your physical identity has changed. I already knew they got rid of cancer. I know that sounds ridiculous, but again, best breast cancer ever. Tiny, right? And if you remove all the breast tissue, the chance of cancer coming back is very, very small. In fact, it wasn't the cancer, it was the identity. It was the physical identity of who I am now, because that changes, it's a game changer. It changes everything, right? You look in the mirror and suddenly you have to get used to who you are now. Within a day of my having surgery, I was up and walking. I went for a walk with a friend of mine, and my friend is 5'11", so I don't know what that is in centimeters, but she's very tall and much bigger than me. and we were walking past windows, and I could see my reflection in the window. And it's the first time I'd actually seen myself, because the mirrors in the hospital are much higher than me. So I couldn't see anything. I couldn't even see my chest in the hospital. And so as we went past this window, I glanced and went, oh. And my friend said, it's okay, it's okay. I was like, no, 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 look. And she said, no, it's okay, it'll be fine. I'm like, you're not listening to me. Look at me. And she said, yeah. I said, I'm a little person. And she said, well, yeah, of course you're little. I mean, imagine, she's much taller. She's this much taller than me. She said, well, of course you're a little person. I'm like, no, I'm a little person. I'm tiny. And she said, yes, Sandy, you're tiny. I'm like, no, I couldn't express myself. I said, you're not listening to me. I said, I have spent 25 years looking in a mirror, and because of my shape, I did not feel like a tiny person. You know, when you look down and all you see is a body part, I didn't feel tiny. And suddenly I'm looking in a mirror, or a window that was acting as a mirror, and I thought, I'm a completely different person now, physically. I'm completely different. And then there's that whole thing of, so what does this mean for me? You know, to me, it opened up more opportunities. It's actually made paddling much easier. Sports are much easier when you're this shape than the shape I was before. And it was just a revelation of, instead of these are things that I can't do, or these are problems, it was like, wow, now this is going to open up a whole new thing for me. I can do something different. Cancer is gone.
Okay, so when did you start the drug and wine disorders, and how? And what's the idea that was like, oh, I have to create this team?
So when I was in Canada the first time, and I've explained a little bit about my situation at the time when I had cancer, I didn't want to talk about cancer. I didn't want to talk to people about it. I didn't want anybody to know. I just wanted to get on with my life. And because nobody could tell, because I'd had a lumpectomy, nobody could even look at me. I didn't have chemo, so I didn't have it to deal with, okay, she's obviously a cancer survivor, she's lost her hair. I didn't have any of that stuff to deal with, which is emotional. And so I wanted action. So I joined a dragon boat team for breast cancer survivors. And it was a great group of women. I paddled with them for 2 years. And the first year, I only learned the person's name that was sitting next to me on the bench. I wasn't there to make friends. I didn't want to make friends, to be honest, which sounds strange, but I just wanted to paddle. It was my way of meditating. The entire time I paddle, I count. When I'm a paddler, I'm counting every single stroke. I'm working on form and I'm counting. And it was the only thing that could really keep me calm through the whole journey was movement. And so paddling, you're moving the whole time. So I did that 3 times a week. The second year, I decided to get a bit more involved, but I still didn't want friends. I didn't want to go for coffee with them. I didn't want to talk about cancer. And I think I was afraid that if I went for coffee with these women, we'd be talking about breast cancer. And I didn't want to talk about it. I have no idea. I just, along the journey, there's different things and different things, experiences you go through. And at the time, I just wanted life to be normal. You know, my marriage had broken up. I wanted to get on with my life, and this interrupted me. And to be quite honest, it started to make me a little angry. I wanted to just get on with my life, and my body was stopping me. And so if I'm, thinking about the body-mind connection, I'm like, okay, why am I not supposed to leave yet? Right? Why is my body stopping me from going where I want to go? And what I wanted was action. So I was taking dance classes once a week. I was lifting weights 3 times a week. I was going to exercise classes twice a week. So that was 5 days a week that I was active. And I was not going to let this slow me down. And so I just wanted more action. I didn't want to sit and meditate and think about it. It was done. It was over. I wanted to move forward. I didn't want to ruminate and sit in it. When I came to Doha, because I'd been paddling, I loved it. So I was looking for a group to paddle with here, and there was nothing. And so the next year I came, it was the second year, there was a message on Enterlac saying, a dragon boat is coming to town. It should be here in October. And I was like, yeah, okay, I'm in. I'm definitely in on that. Contacted the guy within 20 minutes of seeing that message. And so I had organized a panel of survivors. So some of the women who were coming on the panel, they're all survivors. And so I connected with them. And then I also met some nurses at the hospital who said, oh, I might know somebody who might want to come.
6 weeks after my bilateral mastectomy, I had a boat in the water where we paddled for 10 minutes straight. So it's a great feeling of accomplishment.
We count down. Who's number 16? Who's 3? Are you ready? Attention. Rotate first. Go.
The type of paddling is very different from other types of boats. You know, you're over on your side and your arm is coming up above you and it's coming straight down and then going back up. And that pumping action is actually moving the lymph system. And that's why we do it. Paddling means that I am free. Not just freedom from whatever's bothering me during the day getting on the water, but also it's freedom from cancer. It's freedom, it's movement. It's you're going somewhere. You're not stationary and staying in one place, you're moving.
5 more. 1, 2, 3, 4. Easy. Well done.
Take a moment to be still and take a moment for yourself. If there's anything worrying you or hurting you, treatment requires strong belief that it's going to be okay.
We want to paddle for fun. We want to paddle for health. You know, they're a group of people who want to come together and want to do something. Supporters, so they've had somebody in their family who has been diagnosed with breast cancer. I want people to know that women can survive cancer. I want women to get a mammogram if they are going to get diagnosed. It's at stage 1, not at stage 4 after they've felt a lump and were too afraid to go and talk to somebody, because they saved my life. If I hadn't gone for that initial mammogram and had a baseline of what it looks like, I probably wouldn't be sitting here in front of you right now. I think it's that simple.
Warriors!
Live your life as big as you can. Don't let anything stop you from being who you are. If there's something wrong, if you're not feeling well, if you have a twinge, you need to look after it. You need to check it because it could stop you from living the life you're supposed to lead. It's a long life if you're unhappy. It's a very short life if you're super happy. And that means you have to take care of yourself.
Carry this picture in your jacket pocket, right next to your heart, of a world not so far away, but now a world apart. Another faded memory, another twisted souvenir of familiar places and the road which has brought you here. Blessings 1, 2, 3. Remind yourself that in spite of the fences, at least you are free. I know you fall on some hard times lately, and the road has gotten rough. But at times like these, it feels like you can never, ever, ever give enough.
It has a raising awareness message. It has actually everything. It was like one of the best 20-minute film I've ever seen. I'm not actually exaggerating. I don't know what actually to mention. People here are writing in the box. That's an amazing video. So I just want to thank again Ms. Sarah and Ms. Sandy for letting us, for sharing this story actually, and it's so inspirational. I think I will go next to our remarkable open discussion with Ms. Sandy Thompson. Ms. Sandy is the coordinator of the EFL department at College of North Atlantic. She's been living in Qatar since 2012 and founded the Doha Wireless Warriors in 2014. And I actually left the Instagram page for them here in the presentation. She's a breast cancer survivor, a superhero, we can say, an avid dragon boater, and believes that approaching every experience with joy is the best way through times of difficulty and, of course, everyday living. Welcome, Ms. Sandy, with us, and thank you again. Thank you trillion times, actually, for specifying time and for coming and for sharing your story. Would you like to start by saying anything before we start the discussion?
Oh, well, I'm not really sure what to say other than the fact that Sarah approached me last year about doing this video. She'd heard about me through, we have a lot of Qatar University members on the team, and she'd heard about me through somebody, came to see us, and then asked if I would do this video. The interesting thing is I had no idea how much time this would take. I had no idea. And I should know because my background is theater. That's what I did all through high school and university in my 20s. And but she said, okay, well, just one day. And then she'd call and say, can I come over for the day? And my whole fall went into this mode of trying to give Sarah what she needed for this video. And she had these great dreams for it. And I had no idea what she was going to come up with. And I'm really proud of her. She's done a beautiful job. There are other versions of this. This is the first time I've actually seen this version. I saw another version before, and so every time she puts it together, it's different using the time that she had with us.
Yes, yeah. When I actually texted her, she told me that I was really hesitated to which part should I share with you because, as she mentioned in the introduction, the 2 hours of filming is not enough to show the full experience and the inspirational message behind your story. We are actually here inspired and influenced by your story, and would like to ask you some questions. Maybe they are beyond the video. The first question is, there was something attractive to my ears in the video when you said that the doctor said remission of the symptoms or remission of the disease, and that it impacted you negatively. So in line with the, so what was it you want to express your feelings more about this part?
Well, I have to be honest with you. I still hate that word remission. Because I still believe that when you say to somebody, this is in remission, it infers that it's going to come back. There's nothing in that word that says you're cured. And in fact, I wrote down something that Dr. May had said. She said, she used the word cure, a cure, that somebody's been cured of cancer. And I thought, wow, that's exactly how I feel, I really think that when you have to be very careful with your words. Now, maybe it's because I'm a language teacher and I've been doing this for 30 years, so maybe it's more important to me than it might be to some people. But I think we have to be very careful what we say. Another example of that is until this year, actually until last year in the spring, the medical definition of being a cancer survivor was 5 years post-surgery, 5. And I went to speak to the University of Calgary, the nurses there a couple of years ago, and my friend who was running the program asked me, when did you start saying you were a survivor? And I said, the second I was told I had cancer and I got up and walked out of the doctor's office without passing out, I said I was a survivor. Because really, you face a cancer diagnosis from the second you hear the word cancer. Oh, and you have cancer. That's the very first time. So I figured, okay, I was a survivor. But really, up until last spring, the medical definition was you were not a survivor until you had 5 years clearance. And not 5 years from the diagnosis, 5 years from when they remove it from your body, from the surgery. So again, words are powerful. So words like remission, survivorship, or when people say to you, oh, well, you have stage 4, you only have 6 months to live. Well, I know a lot of people, to be honest with you, who've been given that diagnosis, and they're paddling in the boat with me. And it's 2 years, it's 3 years, it's 4 years, it's not 6 months. So we really have to be careful of the words that we use.
I do actually agree with you because, most of us here are future healthcare providers, and they teach us at the university how to show empathy and emotional care and how to choose what we can say, the medical words carefully, so we don't impact the patient negatively. So even people here in the chat are saying, yes, even for us, this is very important. A backup question to this, is showing empathy and emotional care from healthcare provider important, and how can that impact you positively? Talking about the positive side.
That's huge, to be honest with you. The empathy that is shown by doctors and nurses and anybody you come in contact with, pharmacists, is a very big thing. The first time I had cancer, the pharmacist up the road from me where I had to get my medication, because I've never taken medication before in my entire life. So I have cancer, I'm given this little yellow pill, tamoxifen, to take once a day. I started it when I was doing the radiation, and 3 months later, it causes a blood clot. That blood clot then, means that I'm now on 5 medications. a baby aspirin. I'm on, this to slow my heart down and that for my cholesterol because the medication cranked it up. And I was on 5 different things. And that overwhelmed me more than the cancer diagnosis, strangely enough, because suddenly I thought, oh my goodness, I've become a sick person. I'm taking medications. And I went to the pharmacist down the road from me, and I was at the counter, and I remember her saying, do you want me to put these in bubble wrap? And I looked at her and said, I'm not an old lady. I'm 49. I can handle organizing my medication. And then I lost it. I just completely started to bawl my eyes out at the counter, in the grocery store, at the pharmacist's counter, and said, I can't believe I'm taking medication. And it's not the number. It's not the color. I can figure out when to take them. It's the fact that I am taking them. That overwhelmed me. She was so kind. She even called me the next day to check and see how I was doing. Those kinds of acts make such a difference. The nurses who understand that you don't want to be fussed over. When I came off the operating table, well, in Canada or in Qatar, I had 10 surgeries, and each time I jumped off the gurney and headed for the toilet, grabbed my clothes, and head to the toilet to change. And the nurses are always, what are you doing? Like, well, I'm not staying in this blue gown. It makes me feel like a sick person. I'm not sick. I'm sore. You just cut me open. I'm not sick. And most of them understood completely. In fact, the ones that got to know me, because I was at Hamlett for quite a while, over 2 years, would literally open the door and hand me my clothes because they knew this is what I wanted. And those healthcare professionals are the ones that I go up and visit every once in a while because they had such a huge impact on my life. They were kind. They were women. They were just women being women and supporting one another. Same thing with my doctors. Fabulous. I have nothing negative to say about anything in the healthcare system here. Everybody has been fabulous. And my surgeon, all I have to do is show up at his door and he'll say, give me 10 minutes, Sandy, hop in, and answered every single question. And believe me, I have a lot of questions when I do things. I don't go in blindly. I don't let anybody make the decisions for me. It's my body. It's my life. And so I want to be part of that decision-making process. And he was fine with it. In fact, he encouraged it. So I think that, if you are a caring person and you're looking at who you're working with, whether you are giving them medication, whether you see them once, whether you see them 1,000 times, I think the most important thing is that you need to understand that while it's your job, it's their life and it's their experience. So if you're handing out medication that you've handed out to 25 people before that person arrived, and it's the first time that they've been put on medication, you need to be very kind and incredibly gentle, because for them, it's a first-time experience and it's terrifying for many.
Oh, I do agree with you. And the good healthcare system actually makes the patient centered. They involve the patient in the treatment plan. They don't leave him like take this and take that. No, they involve them. And this is one of the great opportunities here in the healthcare system in Qatar. And I'm so glad I actually got to hear a real story. So thank you again for this. Can you tell us more about Doha Wireless Warriors or Warriors?
You're talking about the organization. Number one passion. The Doha Wireless Warriors is a dragon boat group. And what a dragon boat group is everybody paddles in a boat together. There are 20 paddlers total. So 20 paddlers, 10 rows, 2 on each seat, a coach and a steer. The coach, when you're racing, is the person who's drumming and keeping the rhythm of the boat together. The idea behind dragon boating for breast cancer survivors started 25 years ago in Canada, I'm proud to say, on the west coast of Canada by a doctor who was also, I think he was a physiotherapist and also worked with cancer survivors. And so he invited 20 survivors to join him in a boat in an experiment. And the idea was, they were always saying, prior to 25 years ago, they were saying, oh, you can't, and they still do actually, you can't lift more than 4 pounds or 5 pounds. You can't do anything with that arm. You shouldn't exercise. You shouldn't lift your arms above your shoulders, all these old wives' tales. And so he wanted to blow these myths out of the water and tell people, no, this is not true. Of course you can exercise. In fact, you should exercise. You should become as strong as you can. And so he started this experiment to see if anybody would get lymphedema. And lymphedema is, of course, you probably know, is when your system is blocked, there's been damage to the lymph system, and your body part swells, either the chest, the arm, it can be the leg, anywhere that the lymph system is flowing and gets blocked. And for a lot of breast cancer survivors, the lymph system backs up. And so the arm that had the lymph nodes removed becomes quite enlarged. So the idea behind dragon boating is that you're pumping the whole time your arm is pumping up and down, and it's giving this movement of a pumping sensation. So my team, we do both sides, because I think that, you don't want to be Popeye on one side and a saggy arm on the other. You want to be strong all over, and you want to be balanced. And I also believe that it's better for the lymph system if you're pumping it on both sides. So we have been together now, it'll be 6 years this November 14th. We started out, the idea was I wanted a breast cancer survivor team. As I think I mentioned in the film, it's very difficult to find survivors here who believe that they're not dead. And I say that facetiously, but also somewhat honestly, is that I meet a lot of people who think that once they've had a breast cancer diagnosis, they can't do anything. Or people look at me and say, you're not like my mother. My mother's younger than you, and you seem a lot younger than her. Why? Like, well, because I've decided I'm not old. I mean, I am the age that I am. So if I'm 58 and I can paddle like a 20-year-old, well, good for me. But the idea is to stay healthy. And so the dragon boating does that. We started off as a breast cancer survivor team, very quickly discovered that this was not going to work. There's not enough survivors that are out there yet or that are willing to come to the boat. So then it became very much survivors and supporters. And in fact, the majority of the supporters initially came from Custer University because students found out about us and then passed us on to their best friends and then their mother. And so we originally started off borrowing boats, and we met once a week. Then we met twice a week. And then it started to get a little pricey to borrow other people's and rent other people's boats. And, we wanted to paddle more and more and more at the same time as everybody else. So we bought a boat 3 years ago or 4 years ago. I went to China and saw the boat, picked out the dragon boat head and the colors, and it arrived just in time for breast cancer awareness. So we did a ceremony on the 14th, and we've done it every year since. And we just paddle, so we have a lot of times. Last November the 14th, I again begged all the survivors that I've met, and some I haven't met or hadn't met yet, to join me in the boat on the 14th for a ceremony. And it was usually when they're dragon boat racing, they have a carnation ceremony for the cancer survivor team. We didn't have races. We only have one team. So instead I bought roses, which are easier to come by here, and we paddled to a secluded part of Katara, and we had a ceremony. And basically the ceremony is to give thanks and to say goodbye to those we've lost during the year to cancer. And then I asked everybody if they would please stay with me and please come back on Fridays because I really, really wanted a dragon boat team that was for cancer survivors, because that's the reason I started it. I could be paddling with any of the teams here, but I wanted it for cancer awareness, and I wanted there to be a place for survivors to be. There's the Cancer Society, the Custer Cancer Society, and they do workshops, etc. But I wanted something active. I wanted something that would keep us moving and be out there in the community. So now we have, I think there are 20 or 25 people on my cancer list. We have just a Friday cancer group. We get priority on all the paddle times. So right now we're paddling at 6:20 on a Friday morning. Last week we had more paddlers than we had room for, so we had to come back a few times. But we represent, at the moment, I think we represent 8 or 10 different types of cancer. So brain cancer, colon cancer, kidney, breast, thyroid, bone, melanoma, lymphoma, ovary, ovarian, you name it, we've probably had at least one person in the boat. And these are all people at various stages of cancer. So we have people who are still doing chemo now. They do chemo every 3 weeks. We have people who have just finished radiation, people such as myself. I've been out of, I'm 6 years clean. Other people are longer than that. Some people are, we have one person who's going in next week for another treatment for thyroid cancer, another who's going to go in and have hers removed in a couple of weeks. So we have people at all stages of cancer. And we get together, we have breakfast, anybody's having a rough time, we call them, we check on them, we show up at the door. So it becomes a support system and a friendship. So it's no longer the whole team of, our ages span from 18 to 64 at the moment on the team, male, female, you name the religion, we're in there, you name the country, they're probably in the boat as well. But we also have a team that is specifically for cancer survivors. Our steers are survivors. I'm a survivor. We've got 2 coaches who are survivors, and we paddle, for strength. And my dream is that in April 2022, assuming COVID has calmed down by then and people are traveling a lot, inshallah, we are going to go to New Zealand to race as the Qatari Dragon Boat team. It is a cancer survivor competition every 3 years. Last time it was in Italy. The time before that it was in the USA. This time it's in New Zealand. And it's all cancer survivor teams. So a year and a half, 2 years ago, there were 111 Dragon Boat teams of women. And so I really want us to experience that. If we can't go because half of our members are not breast cancer survivors, then we would go as a team anyhow and paddle in a supporter team or jump into other boats with people who are missing members. But that's the goal at this point in time.
This is really amazing and inspiring, having a project and the idea of the project is so deep and it's so inspirational. I'm really in love actually with the project. It's amazing, I can say. We want to know your message to people out there, people who are scared of going for diagnosing because of their fear of the disease. Because maybe I know a family member for me, she was really scared to go to the doctor because she was scared to get diagnosed with hypertension, for an example, although she has high blood pressure. So what's your message for people generally who are scared?
Well, you have choices. I mean, the good thing about life, if we're blessed, is we have choices. So you can choose to go and get checked and perhaps be told you've got high blood pressure, you have to lose weight, take this pill and start exercising. Or you can choose not to go and have a heart attack. There's choices. With the mammogram, I had a friend who, she would not go, absolutely not go, because she was told it was painful. And so I said, okay, well, let me just describe this for you. First of all, I'm 4'10", which is not very tall. And when I had very large triple D breasts, I'd have to stand on my tippy toes to put those girls into a machine to have the mammogram. Not comfortable, but it saved my life. So you can choose to be pinched for 30 seconds, or it's not even that, 20 seconds, and be uncomfortable for 20 seconds, or you can choose to wait until you have a diagnosis of stage 4 breast cancer because you didn't go. And so that's my hardcore sell when people tell me that they don't want to because it might hurt. It's like I had somebody just yesterday say it was free COVID testing, came to the college. You want to test, you're an instructor, go ahead. Most people didn't go because they didn't want to know if they had COVID. I'm like, okay, wait a second. You're an instructor. You were coming in contact with people. Don't you want to know? No, I don't want to know. Okay, right? And so again, I use this as an example because, many people did go because they said, I do want to know. Of course I want to know. And same thing with mammograms. Same thing with colonoscopies. Anything. If something is wrong with you, you feel a little bit off. And most of us know ourselves. You know when you're a little bit off. Go get tested. Because you could be someone like me who didn't have a clue, and it was just blind luck. It was just blind luck. There's no reason for me to have gone for a breast cancer or for a mammogram. In Canada, we don't start testing till you're 50. If I'd waited till I was 50, I would have been a very sick woman, right? Because it would have been too late, or it would have been much larger. My prognosis would have been much worse. So, when people say to me, oh, I'm just not going to do it, I'm like, well, that's your choice. You can choose to get very sick, or you can choose now to go and either find out you need to be on medication or find out that you're fine. That's my answer. Long-winded, but true.
Yes, I do agree actually with every single word you mentioned. And from this point, we raise awareness for the early detection of breast cancer, to being able to treat the breast cancer in early stage before it develops to stage 3 or 4, or late stage, we can say.
Yeah, much better.
Yeah, exactly. What's your final message to people who find it difficult to cope with life generally? You know, for breast cancer survivor, you passed a lot, and I'm pretty sure that there were some difficult times or challenging times for you. People nowadays with quarantine, they are losing hope. They are really bored, and they find this time of COVID-19 very challenging and very difficult. So what's your message to people generally who find it difficult to cope with life from an inspirational tool like you?
I think you need to find your purpose. I think you need to just live your life as largely as you can. When I said earlier in Sarah's film was, if you're blessed, it's a long life and you live it happily. If you're not so lucky, it's a short life. So either way, you need to live it as big as you can, because if you're waiting for example, a lot of people wait until they retire to go and do things, and then they're sick or they're older. Or why are you waiting until you're 65 or 70 to do something? Do it now. And I think my attitude is do it now. During COVID, of course, there were changes in my life. But, I went out, I wore a mask, I wear gloves if I need to, I socially distance and constantly washing my hands, but I am living my life. I am making sure that I live my life safely. And I would say the same thing with cancer, the same thing if people are depressed, the same thing if people are scared, is that if you choose to be in your house alone the whole time, you're going to get lonelier, you're going to get more depressed, you're going to become more frightened, and you're not reaching out to anybody. There are lots of people out there who want to lend a hand, give you a virtual hug, lend you an ear, sit down with you, now we can go for a coffee. And being alone with those fears that we have is not healthy. I think the worst times I had were when I was feeling sad or scared, and I didn't want to bother anybody. I didn't want to burden them. I didn't want to phone them at 2 in the morning. But that's when you're frightened. It's 2 in the morning when you can't sleep. That's when you're scared. You're not scared at 8 in the morning when it's a bright sunny day and people are out walking. That's not when you're scared. You're scared when you wake up in the middle of the night, or you're scared when you can't fall asleep. So people need to know that there are either, online places that they can call, or that they have somebody in their life that they could pick up the phone, or they can text somebody. It's really important to have that connection to other souls out there.
Thank you so much, Ms. Sandy, for your inspirational words. I would keep saying inspirational till the end of the session. I just want to end this discussion by saying your remarkable words in the biography, that approaching every experience with joy is the best way through times of difficulty and, of course, everyday living. Thank you so much, Ms. Sandy, for this amazing discussion. If we didn't have limited time, I would listen to you all the day, actually. Thank you for coming, and please wait for the end for a group picture. Thank you again. And now we're moving to the online questions game led by Tayma Hijazi. Please prepare your Kahoot for some facts and about breast cancer. Hey, Tayma, you're the presenter now.
Hello, everyone. I hope you're all doing well. Thank you all for joining us today. Thank you, Ms. Sandy and Ms. Sarah, for sharing this inspirational story. Marwa said, can you please prepare your Kahoot on your... Okay, so can you please now the game plan? Can you see the game plan now?
Yes, we can. Yes.
Okay, so can you please all just enter the pin code on your Kahoot website? I just wanted to tell you all that if you are following us on Instagram, Facebook, or Twitter, we've shared before an educational post about breast cancer. So I think it will be way easier for you to answer those questions.
Fatima, can you mute the music?
Sorry?
If you can mute the music.
Okay, sure.
No, the one up. The one up.
Is it muted now?
It is muted now, but you can have the sound, but you can mute the music. Okay, you cannot mute the music itself.
Yes, I think now it's muted.
Fine. Yeah.
Okay, can I start now? Are you all in? Oh no, they are still coming in. Okay, so we can wait just 1 minute. Can we start now? I think yes. Okay, so let's start with the first question.
Just wait a minute, please.
I started the question, okay? Okay, so the first question is, in Qatar, breast cancer is in which rank of most common cancer? Is it first, second, fourth, or fifth ranking? Okay, so 3 seconds left. Okay, we can see that like most of you answered the right question. According to Qatar Cancer Society, 31% of the diagnosed cancers was breast cancer in 2016. So let's see. We have Fatum here. I think it's Fatma on the first place. Let's see the second question. Which of the following is not a risk factor of breast cancer? Is it taking most postmenopausal hormones, early pregnancy, BRCA gene mutation, or taking certain oral contraceptives? Which one is not a risk factor? Okay, so 5 seconds left for this
You
question.
you can keep some small music, no problem. Small music.
Okay, so here answer, most of you answered the correct answer. The correct answer is early pregnancy. In fact, it's one of the protective factors, as women who got pregnant, who got their first child after the age of 30 are at higher risk. So let's see the next question. We have here H at the first place, then Ruba, then Sundar. Okay, let's see this next question. Which of the following is a protective factor of breast cancer? Is it exercise, early pregnancy, breastfeeding, or all of the above? Here we want the protective factor. Okay, so here also most of you answered the right answer. It's all of the above because all of these are protective factors of breast cancer. We have here still H at the beginning, then Ruba, then Sabah. Okay, the next question is a true or false question. In early stages, breast cancer is asymptomatic and is most easily treated. Is it true or false? Okay, here the answer, of course, is it's true because the earlier the cancer is detected, the easier it is to treat it, as Ms. Sandy said. We can see still H is in the beginning, then we have Ruba and Jean. Let's see the next question. Mammograms are recommended for all women above the age of? Okay, we have 6 seconds left. The correct answer is 40, and you know, as Ms. Sandy said, it's recommended like after the age of 40 to do mammograms regularly, as it is asymptomatic as at the beginning. So after the age of 40, it's better to have your mammogram. Okay, now Ruba is in the first place, then Reem, then we have Halal Khatib. The next question is, what is the most common sign of breast cancer? We want the most common one. Is it redness of the skin, painful lump, or painless lump, or little blood discharge? Okay, so here also most of you answered the correct answer. It is the painless lump. Although all of these signs are somehow true, but the most common one is a painless lump. Okay, we can see that Ruba is still on the first place. Then we have Reem, then H. Okay, here's a true or false question. Using antiperspirants can cause breast cancer. Is it true or false? Okay, so not all of you, I expected that, not all of you answered the correct answer. I know this answer might be a little bit shocking for a lot of people because it's a common myth that deodorants can cause breast cancer, but the reality that they do not cause breast cancer. Okay, we can see now that Reem is on the first place, then Ruba, then H. Let's see the next question. It's a true or false question. Most breast lumps are cancerous. Is it true or false? Okay, so the right answer here is false. Let's see the next question. We have now still Reem at the beginning, then Ruba, then H. The next question is, what is the 5-year relative survival rate of breast cancer? Is it 50%, 60%, 75%, or 90%? One second left. Okay, so the answer here is 90%, and very little of you answered the correct answer. Let's see now Ruba on the first place, then SH, then Reem. Okay, so the last question is a true or false question. Breast self-examination, if done properly, can replace screening with mammography. Is it true or false? So 4 seconds left. And the correct answer is false because like breast self-examination, we said it's really important, and it's really important to check if there is any like changes, but it will never replace screening with mammography. Okay, so let's see now. The third place, we have here H, and the second place, S, and we have here on the first place, Ruba. Excellent.